but I'm all good now. Welcome to PT on Ice Daily Show. My name is Jessica Davis, and I am coming to you from Pittsburgh, Pennsylvania. We're having a lovely gray day here this morning, but that's pretty typical. But I'm looking forward to talking to you this morning. I'm getting super psyched about the sampler coming up in Seattle, and looking forward to, for those of you attending, we're going to talk about the hypermobile athlete when I'm there. So I work with the performing artists. I am the lead faculty for the performing artists course, and today I'm going to talk about something that is applicable, of course, in the performing artist world, but across the board for all of us, and that's working with a hypermobile athlete. And so there's some controversy with this because, you know, as clinicians, of course, whenever I get a hypermobile athlete that comes in my door, I know automatically that it's going to be somewhat of a challenge. And that's because it's always easier to work with a stiff patient because we just do a few stretches, we get them moving, and all of a sudden they're feeling better and they love us. But with a hypermobile athlete, the challenge is we need to get that motor control, and that doesn't come right away. So I found some interesting research that I'm going to talk about this morning. Just some tips, and then for those of you coming to the sampler, what I'm going to do is actually show you some cool exercises that I hope all of you will enjoy, and we're going to work through those when we're in the sampler, so I'm excited about that. Okay, so this was an interesting article. So this was just published in 2018 in the BMJ, and what they studied was the question of, you know, the assumption that if you've got a hypermobile athlete that they're going to be more likely to sustain an injury. So they looked at 114 athletes, and what was neat about this study was it was across several different sports. So we had running, football, hockey, netball, rugby, cycling, tennis, swimming, and of all of those athletes that they had, 26% of them were hypermobile. So then they studied, you know, well, who got injured, what happened, and looked at the statistics with that. And what they found was interesting was that the hypomobile athletes, so the athletes that were not as mobile, actually were more likely to sustain an injury. So it was the opposite than what commonly occurs, which is the thought that, oh, well, if you have a hypermobile athlete, they're more likely to sustain an injury. So they theorized in this study that perhaps having that extra mobility gives you that ability to properly absorb force and maybe minimize the likelihood of injury. And I think about when we compare tissue, right? For example, like we know that a ligament is more likely to have an abrupt failure just because of the connective tissue lined up in one pattern versus the capsule where you've got tissue that can sustain that stretch. So the other finding was that when a hypermobile athlete did sustain an injury, it did take longer for those athletes to recover, which I think for all of us should come as no surprise as we figure out with our patients in general that this is the case. And they also are more likely to sustain a severe injury compared to the non-hypermobile athlete. But the good news for those hypermobile athletes is that participation in sports is good, right? And so what I wanted to talk to you today too was Ehlers-Danlos syndrome. And I found another fantastic article, and I'm going to post all of these as I do for all of you to reference, but this talks specifically about the athlete with Ehlers-Danlos syndrome and considerations that we need to think about as clinicians. So Ehlers-Danlos is an inherited connective tissue disorder, and its clinical diagnosis is made in the clinic. We can look at the Batten score, and we're going to see that this patient's going to have a higher score in the Batten scale. But ultimately, to be diagnosed, they have to have genetic testing. So if they come back with a positive genetic test, then it's important for us to identify these athletes and know what are some of the considerations that we need for these athletes, because they should and can participate in athletics. So, but there are different types of disorders with Ehlers-Danlos, and so the most common is the general one, hypermobility, and then the third most common is vascular. So there's some differences, and you can look into the article and read more about the very specific differences. But what I wanted to summarize today was some key considerations when we're working with them in rehab. So for those that have musculoskeletal pain, that is the most common prevalence for patients with Ehlers-Danlos, is they're going to have some level of musculoskeletal pain. So when they come to the clinic, we should expect that. And they have more commonly the multidirectional instability. And if you look at, it's interesting in terms of the management surgically, which we want to avoid with these patients, but those that happen to have, that are fortunate enough to have unilateral instability in the shoulder, if they do end up having to have a Bankart procedure, they have a higher probability of doing well with that procedure. But other procedures, surgically do not have as great of an outcome for these patients, and that's because they tend to have multi-directional instability, which we know is more difficult and more challenging. Often with these patients, you're going to find that they happen to have pinch and grip strength weakness. So depending on the athlete that you're working with, if they're an overhead athlete or they're having to have that grip strength, expect that they're going to have some associated weakness there. And this was interesting too, and I would think is sort of common sense, but for those patients who are overhead athletes, you need to emphasize rotator cuff stability and scapular stabilization, and of course do more closed-chain exercises, which we're going to go into later. And then in general, the recommendation is for those patients who have the vascular type of Ehlers-Danlos, it is advised medically that they do avoid collision sports. And so that's important to recognize and of course pick up on if you have these patients that they happen to have that. So another thing that's interesting too is the neurological concerns with these patients. So a high percentage of patients with Ehlers-Danlos have also Chiari malformation. So it's recommended now that if you have a patient that's been diagnosed with Ehlers-Danlos, that they are automatically screened for Chiari malformation. And it's required and recommended now that they undergo a cervical MRI if they report frequent suboccipital headaches, and if these headaches are increased with Valsalva or increased activity. So if you've got an athlete and they have Ehlers-Danlos, they have frequent suboccipital headaches, you're seeing them, remember that the current guidelines now require or suggest highly that they do undergo cervical MRI because we need to detect if they have that underlying Chiari malformation. So the other is cardiac concerns. So there is that underlying valvular involvement. So a lot of these patients can have that misdiagnosed or undiagnosed in essence. And it is now suggested that they undergo a thorough cardiovascular screen. So when you have a patient who comes in, they have Ehlers-Danlos, it's important for you to do your cardiac screening questions. And we all know those cardiac screening questions, but we need to ask them and pick up on the fact that this may be present. And it also is recommended, if they have not had this done, that all Ehlers-Danlos patients get a baseline echocardiogram. So upon diagnosis. So this is a nice opportunity so they have a baseline. So if there's a change as they go through, we are able to recognize that they're having some underlying potential valvular involvement. So we need to pick up on that. GI concerns are also an issue. So there is a risk for these patients to have some type of visceral injury. So when it comes to athletics, we need to pay attention. If the patient has had some type of trauma, we need to think that this is an athlete that could be potentially more at risk for having some type of issue. So in these patients, it's highly recommended that they have some type of abdominal evaluation by an MD. So if you've had this athlete, they've had an incident in the field and you think that there's some risk, then automatically send them to the MD. So in summary, these athletes need thorough cardiac screening and potential abdominal injuries in this type of concern. So there was a nice case study that, again, I'm going to publish this third article, where they used the Maitland model working with a patient with Ehlers-Danlos who had cervical and lumbar pain. And of course, big fan of the Maitland model, obviously. And I think what was really nice about this article was it talked about in rehab how we need to be patient with these patients because they will take longer to get to their ultimate goal. And it's not uncommon to have waxing and waning of symptoms. So you may make some steady progress when you're working on lumbar stabilization and core work and facilitation exercises, but then you may see that the patient comes in and has a downturn. But don't don't get discouraged with that because that's common. And the key with them is, that positive expectation, the education piece, and the motivating piece to stay active. Because unfortunately, a lot of these athletes are discouraged from staying active. And that's still a misnomer, which is why I wanted to start this talk with the evidence that actually, if you're hypermobile, you're less likely to get injured. So even if you have Ehlers-Danlos, it's good for you to stay active. And it's important to know, of course, what type you have. And if you do have the vascular one, you need to make some accommodations to that with collision type sports. But in general, it's important to stay active as with any human. But a lot of these patients are unfortunately discouraged from exercise. And I can say that firsthand when I've worked with my patients, getting them to get active and stay strong has been very rewarding. So what do we need to think about in general with our hypermobile patient? We need to make sure when we're doing our exam that we are taking them through that entire full range of motion. So it can be, alarming when you're working with that hypermobile athlete to really get to that true end range. But we talk about that, especially if the irritability is low. When we're trying to figure out and problem solve with this kind of patient, you've got to get to end range. You've got to feel it, because if you don't adequately clear a region. So we need to make sure we're on that asterisk hunt and fighting that. The other thing, when you're rehabbing them too, remember that you need to work through their entire full range of motion. And with these athletes, it requires a lot of extra attention to detail. You need to slow them down. You need to look where they may be excessively recruiting some regions of their body to get somewhere, and then help them activate the proper musculature to achieve that neuromuscular stimulus. And then in summary too, prior to participation in sports, whatever athlete that you're working with, these athletes should not be doing, obviously, static stretching. We know static stretching doesn't lead to increased performance, but especially in the ballet world, which is the world I'm in most often, unfortunately, these athletes are still doing static stretching. But in general, give these patients, all of them, a good routine, simple, sweet, that will rev up their neuromuscular system, get them going before they participate in sports, because we know that's going to improve performance. It's going to help these athletes ever more. But also remember, don't discourage these athletes from participation in sports, because just because you're hypermobile doesn't mean you can't be active, and actually you're less likely to get injured. So I'm going to share all of these articles because I think it's pretty cool information, and I hope you guys have a wonderful Tuesday. Get out there, enjoy, make a difference, go make a change, and thanks for watching, and I'm looking forward to meeting some of you at the sampler. All right, take care. Have a good day, everyone.